Hello to everyone. My name is Mustafa Zuhair Mahmoud and I am a radiology and ultrasonography professor and consultant. In Saudi Arabia, I work in the Radiology and Medical Imaging Department of the College of Applied Medical Sciences at Prince Sultan bin Abdulaziz University. My topic will be utilization of ocular B-scan ultrasonography to determine the causes of impaired vision in diabetic retinopathy patients. And my co-author in this work is Dr. Moran Fagiri, a colleague at my workplace. As an introduction, I can state low vision defines vision impairments that can be treated with medicine, surgery, or eyeglasses. Diabetic retinopathy and diabetic eye problems are increasing worldwide, especially in North Africa and the Middle East. B-scan ultrasonography is beneficial in proliferative diabetic retinopathy. In terms of the study's purpose, unfortunately little is known regarding the risk factors and prevalence of diabetic retinopathy in the Sudanese community. As a result, the purpose of this study was to use ocular B-scan ultrasonography to determine the causes of impaired vision in Sudanese patients with diabetic retinopathy. Following authorization from the local ethics board, 100 patients with diabetic retinopathy of varied grades were recruited between September 2016 and January 2018. The first item in the Material and Methods section is the criteria for patient selection and description, which are as follows: Sudanese nationality, diabetes mellitus, no hypertension or ocular hypertension, no history of ocular trauma or surgery, no afferent pupillary conduction impairment, and no insulin administration. The second point in the Material and Methods section is detected to ophthalmic B-scan ultrasonography examination, where all sonographic examinations were performed by the same sonographer in a supine position in a thermally controlled environment. B-mode was accomplished utilizing a NIDEC ultrasonic instrument with a 10 MHz transducer. Ultrasound gel was employed as a coupling material. Minimus tetracene hydrochloride eye drop solution was used for local anesthetic. Special concerns for ophthalmic B-scan ultrasound. To establish the safety of ocular imaging in the current study, the probe and ultrasonic scanner instructions focused on initial power setting, exposure period, and stationary probe. The ocular ultrasonography transducer was withdrawn whenever a real-time image wasn't needed. During eye exams, thermal and non-thermal risks should be minimized. A statistical diagnostic test determines the sensitivity and specificity of ocular B-scan ultrasonography in diagnosing decreased vision in diabetics. Statistical analysis was done using SPSS version 20 for Windows. This section of the presentation will go over the current study's findings, which are as follows. In this prospective investigation, 100 non-diabetic patients, 200 eyes, had conventional physical, ophthalmology, and B-scan ultrasonography tests. Table 1 shows that in the male population, 25 patients were in the age category 47 to 57 years, representing 33.3% of the population, while in the female population, 10 patients were in the age group 47 to 57 years, representing 40% of the population. According to the grading of the condition of retinopathy using the early treatment of diabetic retinopathy scale severity level, data show that the majority of patients, 34%, present with moderate non-proliferative diabetic retinopathy. In the current investigation, ultrasound of the eyes revealed that vitreous hemorrhage, retinal detachment, posterior vitreous detachment, asteroid hyalosis, and choroidal separation were the most common causes of visual impairment among Sudanese patients with diabetic retinopathy. Here are the most important cases detected using B-mode ocular ultrasonography scans in the study sample. Figure 2 shows a 20-year-old male's B-mode ocular ultrasonography showing a new vitreous hemorrhage. Figure 3 demonstrates posterior retinal detachment in a 39-year-old woman. Figure 4 shows an ocular ultrasound scan of a 25-year-old girl with scatter hyperechogenic foci with astroid hyalosis. The following facts can be provided as part of a discussion of the study's findings. The sensitivity and specificity of any screening technique are used to determine its effectiveness. In this investigation, the sensitivity and specificity of ocular ultrasonography were 98.95% and 85.71% respectively. Sudan had 17.2% diabetic retinopathy in 1991. Moreover, most diabetes patients were from the center of Sudan, meaning that low eyesight causes were more widespread in this group than in others. This study is hampered by the unequal population due to the randomized selection approach, which may impair the precision of the diabetes retinopathy influence on our measurement parameters and lessen the power of our conclusion if applied to different age groups in future investigations. The value of the current study is that it's one of the latest studies that determines the reason of low vision among diabetic Sudanese patients with diabetic retinopathy by employing ocular B-scan ultrasonography, which is likely to be modest in magnitude since the study was population-based. In conclusion, ophthalmic B-mode ultrasound is a rapid non-invasive imaging technique that can be used in ophthalmological practice with minimal discomfort for the detection and evaluation of diabetic retinopathy complications. It shows the nature and extent of diabetic effects in eyes with vitreous opacification, which is not visible on ophthalmoscopy, assisting in determining clinical treatment, surgery, timing, and visual outcome. Now, the study's references. This slide continues the presentation's most important study references. Thanks for watching. Now that we have completed the presentation, I would want to thank you again. Until next time, take care. Bye-bye.